Hi everyone, I'm Sanampua from Center of Balance, the acupuncturist. Hey, tonight it's 9 o'clock now today, and I just finished some work, some uh, presentation, and I want to talk about urinary incontinence today. This topic actually uh, is a very common issue for elderly person, right? Um, it also have a little sign, beginning sign for those who is who has have a baby, right? So in Chinese medicine, we talk about 9 out of 10 women who had baby had a bit of urgency or can't empty, probably can't hold the urine. Uh, in this condition is just mild in the beginning, and when you age, it go worse and become urinary incontinence. All right. Yes, you in Western medicine they will give you some exercise, and some work very well to be honest, but some actually doesn't work. Okay, so our clinic we treat these issues with great results. So if you suffer from urinary incontinence or urgency urine or difficult to empty your urine, then this live video is for you. It's for you because I'm going to show you some simple exercise with your breathing, and that's going to help it. Okay. Um. Now, so if you're on Facebook, if you're on YouTube, please share this video with your friends, family, and Facebook. Please tag your friend in, tag the names in here if they suffer from here or they're embarrassed that you tag the name here. Simply just um, share this live video on your page so they know that you are actually watching this and they know that they should watch this video, or just take the link and send it to them, send email to them, and so they can replay this video later on. Okay. All right. So if you're here, please type your name and let me know where you're from, and give it a thumbs up because I know that let me know that you like this video. Okay. And that will keep me going to produce more video to you and share my knowledge and information to you. Okay. A simple idea. Okay. I know this idea is not fancy. It's not fancy. It's a common sense. Okay. I'm going to share with you the common sense. Hot air balloons theory. Okay. Hot air balloon theory. Okay. I'll share with you, and I'll share with you the exercise as well. And a simple exercise, very simple. Everyone can do that. And then I'm pretty sure that my patient recently, and both of them, and the doctor tell them this is normal. They have urinary incontinence, and that's normal because you're old. One's 80 years old, one's 60 something, right? And this is normal. They both told me, the doctor told them this is normal for them because they're old. I said, this is not normal. Well, use common sense. That's because your doctor doesn't know the idea what's causing it, just because they don't have good treatment for this to help you. Then they tell you this is normal because they can't fix it, they can't help, and they tell you this is normal. Look, this is common sense. If this is normal, if you're 60 years old, you suffer from urinary incontinence, then everyone who reached 60 years old, they should have this problem. But the answer is not everyone suffer from it when they reach 60 years old. If you reach 70 years old, you suffer from this, you ask the same question. Do all 70 years old female suffer from urinary incontinence? The answer is no. The answer is no. Right? It's so embarrassing. My patient, they have to use pad. Some of them have to use nappy, adult nappy, because they can't control the urine. They can't hold it. It just comes and it wet the undie. And they go out, they have to take some pads or a few pads or nappy and undie with them. And at night time when they sleep, it just accidents just happen. And they have to change the undie, have to change the bed, just like little baby with their pains. This is awful. This is awful and it's so embarrassing. It's so difficult to go out. You see, this is all pain in the butt. Then you and me, we can't feel it. But I see a lot of patients and they tell me all this. Okay, so this is the real problem. That if your parents, your grandparents, they suffer from this, you need to send this email, this link, this live video to them. Okay. Now, if you this exercise I'm going to show you, if you have urgency urination, if you have, if you go to urine too frequently, if you have, if you can't empty your urine properly, what's the sign? You go passing urine, and then you come out and say, "Oh, it's not empty properly. I need to go again." Straight away, you go in. Oh, that's pee again. That's another one. Okay. So doesn't matter you female or male, this exercise is going to help you. Guarantee it. Okay. This is how you do it. Okay. Normally, I put 3 needles on the head. Okay. I use this little needles, 3 point on the head over here. On the center, we call 220. Okay, I put 220. 3 needle on 220 over here. And why are we doing this? We want to reconnect the brain to the bladder, to the pelvic muscle. Okay, we want to reconnect it, and it works very well for those patients who can exercise, who can laugh, who can cough, because when they exercise, when they laugh, when they cough, this just happens. They're not old at all. They're only 40 something, just because they have few kids. After a few kids, they have this problem. You know, they just wait their pain. A little bit, not too bad, but this is too embarrassing for them. So they stop going to the gym, they stop going for run, they stop going exercise. So and then they put on weight and they don't know what to do. This exercise is going to help you, believe me. Okay, this exercise is very simple. It works better with acupuncture if it may work for you without acupuncture. So give it a go. So it's very simple. We call Hui In point. Over here, there's a Hui In point. Okay, and here we can needle that, but for me, I don't needle here. It's a very privacy area. I don't needle here. Okay, I use other method. I balance the organs, mainly the kidney, and if there's other organs involved, I balance the other organs. The second one is mainly the heart. Get the heart and the kidney young energy up, and then it can warm up the bladder, and then you can hold the urine and you can control your urine better, and you won't suffer from lack of bladder control. Okay, the theory first before I show you the exercise. The theory first. Have you seen the hot air balloon? We're in Hamilton, New Zealand. Every year we have a hot air balloon festival. And the hot air balloon so big, the balloon, and what is the energy, what theory is it for the balloon to go to the sky and carry people, carry heavy stuff to the sky? Do you have any idea of that? It's the heat. It's the heat. They have to increase the heat. The heat going and the balloons go. They want to go down, they reduce the heat and the balloons go down. Okay? This is the key, the heat. Okay. The bladder connect to kidney. They both belong to water. And the kidney has got original energy, which is heat, fire. We call kidney fire. We also call Mingmen. We also call Xiang fire in Chinese medicine. In this fire, kidney fire, warm up the bladder. So the bladder will have the power, just like hot air balloon, to hold heavy urine, the water. I hope that makes sense to you. This, if you don't understand this theory, you're never going to fix it. Because we understand the theory, this is common sense. Because we understand the theory on hot air balloon theory, so we can help with urinary incontinence. Okay, I help a lot of people. So now you know the hot air balloon going up the sky because of the heat. And in our body, you want to heat up the bladder is using the kidney fire. So in Chinese medicine theory, it's the kidney fire reduced, then the bladder has lost the ability to hold the urine. Simple as. Now we know the theory. How do we advise the patient for the simple exercise? Okay, here is the simple exercise. I said, well, we need to do the Hui In point, contract the Hui In point. And it's just doing the contraction, it doesn't work. You need to contract and pull it up. That is the key, contraction and pull it up. Where do you pull it? You use your mind to pull it up. How do you use your mind? I'm going to share with you. This is very, very variable, okay? Very variable, okay? This is how you do it. Okay, so have you had any experience? How do you contract the Hui In point? You know, the first step is it's hard. You know, you can't feel it and you don't know what way is Hui In point. Hui In point for female is where your vagina and the front part and anus in the back. So between your vagina and anus in the middle, that's called Hui In point. Okay, it's called Hui In point. And for male, it's between your anus in your testicle, and that's in the middle. There's testicle and that is anus in the middle. That's Hui In point, and you want to contract the middle part, this middle part. Okay, and it's hard. You want to contract. How do you contract it? And we'll think about how do I contract the muscle? It's hard. Okay, but I'll make sure you get to that point. How do you make sure you get to a point? It's easy. Have you had experience when you go to toilet for urine, you want to stop your urine, you contract the front part. So you do a contraction on the front part. You can do it now if you're watching this video. Try it. Contraction, let go, contraction, let go, contraction, let go. Just the front part, the urine part, okay? And now you try to exercise, not the front part, the back part, which is when you go to toilet for bowel movements, passing bowel movement, and then you want to suddenly stop it and you contract your anus. Contract your anus. Let go. Contract your anus. Let go. Contract your anus. Let go. I'm doing it right now. I'm just showing you by my head, but actually doing it right now. Okay. Now you want to contract your anus, and your urine part, both. Okay, at the same time. If you contract your anus and the urine part together, And the middle part, it will contract. You contract here muscle, and here will actually contract. The contraction would happen in the middle. Okay, so give it a go. Contraction, let go. Contraction, let go. Both of them, okay? Both of them, front part. And then, so when you do contraction, and then let go, you let go slowly. Contraction, let go slowly. Contraction, and let go slowly. Okay, now you know how to do the exercise. Next, we want to add on breathing. How to do the breathing? The breathing is so easy. You don't do that. Okay, you want to do short one. You just using your nose. Short one. Okay. You want to do this. Okay, like just your nose. And let go. You can do breathe out. You can use your nose or your mouth, either one, but slowly. Don't do that. Okay, just slowly, and then slowly go out. Now, you combine the breathing and the contraction. Okay, this is how you do it. The front part and the back part, you do contraction, contraction, contraction. When you breathe in, you contract a little bit. When you breathe in, you contract a little bit. When the last one, number three time, when you breathe in, you contract fully. You fully contract. Do the contraction fully. Okay, this is how you do it. Let go. And you let go. You see, my hand is within the front part muscle and the back part muscle. Okay, do it again. Okay, whatever you're doing right now, it's just doing in this way. Okay, just and this level on your anus and your front part level, you're just doing the same level. You're not doing it up, up, up. I want you to pull it up. That's why we use 3 needles on 2 bai hui, 3 needle over here. So it linked up your brain to your to the bai hui point, to the bladder. Okay, so we link those two. So you want to put your mind on the top of your head, and then you're thinking about that as a rope actually tight to both parts. And then when each of your contraction, you go and you pull it up a little bit. And where do you pull up? You pull up to top of your head. I hope that makes sense to you. Okay, just pull it up here, and then you let go. Okay, do it every day. Very simple. If you're not quite sure how to do it, come to us. We can show you and put a needle in and use it to you. So for not very severe patient, those patients have urgency to go to toilet. They can't hold urine, and when they exercise or they laugh and they cough, they have accident happen. They leak. Okay, I normally give them 2 treatments: acupuncture over here and exercise, and then weigh the needles home and then keep exercising. Then after 2 sessions, there's a lot of things come back and say, guess what? I no longer leaking. I laugh, I can exercise. That's it. So simple. And what you need to do, how often you need to do this? You need to do this whenever you go to toilet for urine. You sit in the toilet, do not pass your urine first. You practice this exercise for 3 times or 5 times. At least 3 times. You practice it first, and then you pee. You pass the urines. Once you pass out all urines, you need to practice another 3 times or 5 times before you stand up. Okay, so every day. Okay, this may work very well for you without acupuncture. If it does, congratulations. Keep doing it every day. Every day. When you do you when it all heal, fantastic. You know, you keep doing it. I remind a patient just do it daily, because if you don't use it, you lose it. If you don't exercise it, you lose it. Okay. But most of the patient, they forgot to do it. They so well and they forgot, and I said, and then when it leak again and they start to do it, and it might not work for them. I said, well, this is the time you need to come to see me, because I need to put needle on your head to reconnect your brain to your bladder and the pelvic muscles. I hope that makes sense to you. If it doesn't work for you, you need the treatment from acupuncture to reconnect your brain to your pelvic muscle. This is must. And normally just take 2 treatments if not severe. Okay. If it's severe one that you have urinary incontinence, then that's not just 2 treatment. It requires more treatment. If you just have a bit of leaking accident, normally just 2 treatment in my experience. Okay. So letting you know that you can call us, and the number is 0800 221 224. And you can email us above this video or below this video. That is our email address. You can email us, book an appointment, and we're happy to talk to you. Okay. But that's it for today. And if you find this is helpful, please give us a thumbs up and share it with your friend. And hopefully tomorrow I'll do another topic with you. And if you want any topic relating to health issues, and then you want to know the acupressure point, you want to know how acupuncture works, you want to know how Chinese medicine works, or you want to know just some information about any health issue, please type it down there or send us an email and comment down there, call us and talk to us, and we're happy to do the contents, share with you our knowledge. All right, stay awesome, and I'll see you next time. Bye bye.